Right, well, it's just over a week to go till REUK, and I'm here with Dr. Amit Pawa, the president of REUK and the brains behind REUK 21, along with Dave Johnson and Kim Russin. The board thought it was only fair that, having interviewed most of the faculty, that Amit got questioned himself. So it's fallen to me to ask Amit a few questions. Before we start, though, Amit, just tell me how many people are registered now. I know you get a daily or twice daily update. So what are we at?
So we are currently sitting at about 670 registrants, which is the biggest registration for any RUK meeting we've ever had. So I'm absolutely over the moon. 670 so far. I think we're probably going to hit over 700 by the time we get to the meeting, if not more. So that's amazing news.
Phenomenal. I think that really just reflects all the work that you and Dave and Kim have put in. It's amazing. So it's going to be fantastic. So just tell me, how excited are you? Are you a bit nervous? Or?
I think probably gauging by the amount of stuff I've been putting out on Twitter, you can probably gather I'm really excited. Truth is, I'm a little bit nervous. It's a big deal. This is our first foray into this world of virtual meetings on this scale, but I've had such amazing support from our amazing team. Kim Russin and Tim Mull helped put the idea together for the REK 20 meeting for last year, and of course, coronavirus had its impact on us, and we weren't able to run that meeting. And Dave Johnson's literally just taken the reins and run with it. So he's really put a lot of effort into it. So I'm over the moon that we've got so many people registered, and I'm super excited. I can tell you now, it's going to be a brilliant meeting. We've got brilliant faculty, so. I'm very excited, but extremely nervous. There's lots of fun stuff planned for the couple of days, so a few surprises as well. But I'm really looking forward to it.
What are you looking forward to most?
I think deep down, I've always wanted to have a role starring in my own TV show, or maybe even be an actor. So this is my opportunity to do that. Thankfully, I'm going to be supported with a colleague. There'll be a surprise reveal on the day for who's going to be helping me on my journey to take you guys through REQ 21. So it's exciting to be able to host a show like this. And actually, the fact that we've got so many people from all over the world, I'm really happy we're showcasing our UK speakers and giving them a platform. So I'm just looking forward to learning. So to introduce our amazing speakers and learning from all the great pearls of knowledge and information they're going to bring to you all.
So we're going to have to get tuned in right at the start then.
Oh yeah, you don't want to miss the starting. The starting is going to be what it's all about. Many of these conferences, people say, "Oh, I'll just tune in after registration." You guys want to be there for the beginning. Trust me, it'll be worth it.
So it's only a week to go, but we've already discussed we can keep it going for a year afterwards. You've got access for a year. So tell me, apart from that, what else? Why else should we register? If you were talking to your trainees, are still, even if you can't get study leave, why should they register now still?
I mean, I think the reason the meeting is so unique is that we are literally approaching regional anaesthesia at all levels. So those people who already have a skill base, we've got lots of really informative talks on day 2, talking about things for the more advanced practitioner. If you're a novice to regional anaesthesia, some of the earlier sessions give you an insight into how you can apply that basic knowledge of regional anaesthesia to some complex clinical scenarios. And also we're talking about different aspects of ultrasound. So the thing I'm really looking forward to, as well as all the other symposia, is the POCUS Symposium. I know those guys have got something really exciting lined up. And from my point of view, I've got a basic proficiency with ultrasound. What I'd like to do is to learn how else I might be able to use it in a novel situation. So the symposia are going to be great because they're all practical tips and pearls from the experts. But the second day, we're talking about sustainability, about human factors, about top papers. There's always going to be something that you sit and think, well, that's going to be really exciting. And it's great to have an update on things like obesity in regional anaesthesia, pediatrics in regional anaesthesia, and obstetrics. So I think there's going to be something for everyone. The other thing that's interesting is we're talking about really topical thing, rebound pain. We've got Ki Jin Chin talking about rebound pain. Some people believe it exists, some people don't. And I really want to hear Ed Mariano give his Bruce Scott lecture. So I'm sure there's going to be some topical things in there. I could sit here all day, Alan, and read you the program. I think it's going to be exciting.
So much stuff to look forward to. Right, well, you know what's coming next then. We've got to pick your 3 blocks. You've done it to everyone else. So what's your favourite upper limb block?
I think my answer would have changed depending upon what phase of my career you asked me. When I first started, 100% I would have said supraclavicular, the spinal of the arm. I've now seen the light, thank goodness. And then I enjoyed teaching auxiliary because it was such a lovely, simple block. And when you're teaching it, you get to perform at least 3 or 4 needle changes of direction, and the training's got the most out of it. But now, without a doubt, my favourite upper limb block is the infraclavicular. It's just, I was fortunate enough to do a list recently by myself where I had 4 patients, and I did a different technique for each of those patients, all valid indications. And the block that I love the most is infraclav. It's versatile, it's reproducible, and it's a great place to put catheters. So infraclav is my #1 choice for upper limb blocks.
Okay. Lower limb?
I'm going to be slightly controversial here. I know it's hip and trendy to talk about femoral triangle or adductor canal and IPAC, but the block that gives me the most satisfaction, it's not the popliteal. I know that a lot of people love the popliteal. It's a great block. I love the ankle block. Does that make me a little bit unusual? I don't know. I love it.
No, because you've copied me. That's why. That was
Did you say ankle? Oh, yeah. Well, listen, we must have something in common then in that case. I love it.
In the background as well.
Oh, well, no, that was the background is thanks to you. There's no doubt. But the ankle block, I love it because again, it's a technique which not everybody's managed to grasp. And when you can teach somebody how to do an ankle block well, I think it's like a light bulb moment. And I do a lot of awake foot and ankle surgery, not as much as Tony Allen, who's going to be talking in our lower limb symposia, but I do a lot of it. And I think it's really great. Patients love it when they can have their, painless surgery, or they wake up after a GA and feel comfortable. And you get 4 to 5 blocks per foot. So yes, ankle block is my favourite lower limb.
And trunk, do we need to ask?
You probably don't need to ask that. Undoubtedly, paravertebral block is my favourite choice for trunk, and that probably doesn't come as a surprise. So paravertebral is king. The king of blocks is the paravertebral block, and I'm very grateful to John McDonnell who taught me how to do that block. So I'm very grateful. So paravertebral is the best block in the world.
Brilliant. Right, well, I've got one last thing to finish off with. I'm going to see if you know the punchline to a dad joke, except I'm not very good at telling jokes. Okay, so here we go. Right. 2 cowboys walking through the desert. Okay, they've been stranded for days. Total disaster. Lost their horses. No water, no food. They're starving. And one of them sees a tree covered in bacon. So he shouts, "Oh, we're saved. We're saved. There's a bacon tree." So he goes running up the tree, and just as he gets to the tree, he gets shot. Bang, bang, twice. He's dead. So Amit, what was it? It wasn't a bacon tree, was it?
I think. What is that?
Ambush.
Oh no, a ambush. Oh no. Well, Alan, I think with that sense of humour, you are absolutely ready to take the mantle from me and be the next RUK president. That sense of humour is solid. The ambush, brilliant.
Great. Right, well, it's been great talking to you, Amit. So only a week to go, so still plenty of time to get signed up.
Yeah, get signed up.
Can't wait to see everyone. It's going to be fantastic, hopefully.
No, really looking forward to it. Alan, thank you for making me squirm. I was nervous about that, but you did a very good job of making me feel calm. So thanks very much for that. And see you in a week.
Yep. See you later.